Should we begin?
Okay. Hello, doctor.
Hello, how are you today?
I'm all right, thank you. How are you?
Good. How may I call you?
My name is John Smith.
Well, Mr. Smith. How can I help you?
Doctor, I've got um, some pain in my lower back. Actually,
Let's see.
it's a specific spot. Just where the lower part of my spine, but to the side a
Yes.
little bit. Yeah, it's
I see.
one spot that is hurting.
See, I understand it could be distressing for you. Uh, do you have any change in your activities recently or any trauma to that location?
No trauma, but yeah, probably it's been 6 weeks since I started to exercise more. I'm training for a competition. There's a rowing competition, and in the Olympics, and
Oh,
so
very well.
that's why I'm trying harder than before. And
I
yeah,
see.
and yeah, now that you're saying, yeah, I've had this pain for 2 weeks, so maybe yeah, it's yeah, well, it might be related. Uh, yeah,
Has
okay.
this pain been worsening?
Well, it's worse when I sit up. But yeah, and when I do sit-ups because I have to do sit-ups every day.
I
Um,
see.
yeah, maybe it's worse. Yes.
I see. Do you have any other symptoms associated with your pain?
No, not for example. What, for example?
Like, do you have any, like, do you feel any numbness anywhere?
No.
Okay, good. So, do you want to, do you need to continue your exercise?
Oh,
Do you
yes.
expect,
Yes. Obviously, I have to train.
I see,
It's not possible to
I
stop
see.
now.
So, I can see that you have pain in your lower back, and it's probably associated with the increase your exercise intensity. So, we may recommend to you to decrease the intensity of your training at least temporarily, and also you can work with the physiotherapist
I
to.
can't, doctor. I'm very busy now. It's when it's not possible to not to exercise, and it's not possible to see a physiotherapist because I have to train. And
I
uh,
understand.
yes,
Yes. Do
is
you
there
know
any
the
other way? Yeah, is there anything else you could do?
do
Perhaps.
you do you know what would be the consequences of continuing to increase your intensity of exercise when you have a muscle or joint problems?
Mm, well, I'm strong enough, that I can somehow cope with the pain. But yeah, but I don't want to miss this competition. It's and is there any injection or something you
I
can give me?
understand. So the I understand that it could be very distressing for you and you want to solve the problem very quickly, but we want to address the root of this issue because it's very important for you to get to your competition. And if you do not make a commitment to make very fundamental steps, like working with a physiotherapist and lowering the intensity of your exercise, at least temporarily for now, it may cause more problems in the long term and you may lose the ability to compete in Olympics. So,
Okay.
yes,
So what is what do you mean by the root of the problem? Do you think it is because of overexertion?
yes, it's very possible that because you increase the intensity of exercising very fast, it may cause some problem and it's common for athletes at your level. So I think it would be best for you to work with a physiotherapist to make a balanced exercise regimen
Oh,
and you can do exercise which is appropriate to the level of your fitness and increase that over time and
right.
lower the risk of injury. Do you
I
agree
see.
with that plan?
Yeah, okay, that sounds reasonable. So you think that I can make the Olympics?
I think it's very likely if you um, uh, commit to work with the physiotherapist Yeah, it would be
Okay.
very possible.
Right.
Do
Okay.
you have any other concerns?
No, that's it. Thank you,
Thank
doctor.
you.
Very good. So how does that feel?
It was very good. I just made one mistake. I asked a compound question in the beginning.
Mm-hmm.
I
Okay, so it's a 29-year-old male with back pain. Uh, okay,
Can you
and
please share your screen?
oh yes, sure.
Thank you.
Okay, so what's your feeling now? How do you feel?
It was very good. I felt very good
Okay,
about it.
very good. Okay, and what score would you give yourself? 10?
8.5.
8 to 9? Okay, out of 10. So, um, yeah, so what went well? Nearly everything. So, because you said it was quite good. And what could be done differently?
I think I'm prone to to ask compound questions. Like I do that from time to time. I should be very conscious about it, not to ask them. Like ask one question and then go for the next one.
Okay. Okay. Yet, so then compound questions. Okay. Avoid compound questions. So you did some compound questions that you want to avoid. And what else?
I think I like one time I cut off the patient. I should have not done that. I did not notice that he's continuing to talk. I thought he has stopped. So I
How?
should probably
How
wait for a second or two before I start
good.
talking. And not
Okay. So what can you do besides a pause? You can do something else. In terms of signposting.
mm, I don't know.
Yeah, basically, when you pause, then you check. And you can say, okay, what do you think? And wait. Okay. So it means proactively pause, not wait for them to show you the sign they might be having a question. Okay.
So what do you mean exactly? Sorry, I didn't get it.
Right. Okay. Signposting means you give a signal that you are now you have finished with one part of the explanation, and you're checking, and then you want to go back to the next part of the conversation. In a way to be systematic, okay, proactively, be structured. It means you chunk and check. Okay, basically, what you do is mm, to get patient's agreement first, and then go to the next step. Okay,
I see.
stage by stage, and to make sure that there is no question. So, and if you feel that the patient has a question, then you just pause there and say, okay, you got a question, and listen to it. Okay, and either answer there or say, okay, I was just going to talk to you about that. Right. So basically, what we say, there are two systematic ways of chunking. Okay. Uh, you know about chunking, yes?
Yes, you told me about it. Yes.
Okay. So we either chunk by, for example, like my opinion or my diagnosis, reasons, and then you say the causes and management options, uh, and then prognosis. Another way is actually with ICE. So you say, okay, so what you're saying is that you've got this pain, and now do you think it's related to your back? Yes. Related to exercise? Yes. Okay. And you're concerned you might miss the competition? Yeah. So what would you expect me to do? Okay. Uh, and pick up on cues. Was there any cues that you didn't respond to?
I don't know, because if I didn't respond, I probably missed them.
Mm. I said, is there anything else you
Oh,
could do? Something like an injection. So that's an expectation, okay? And then you need to explore that. Okay, what do you mean by injection? And then he says, well, one of my friends had an injection, and his back pain got much better. And then you can explain, and you can say, well, that is a temporary fix, and it's probably causing more harm. Uh, but in any case, it's right. So by chunking, I mean, you didn't actually say what your diagnosis is. And finally I said, well, so you mean, so you mentioned the root cause. You need to reduce your exercise level, but you need to first give me a diagnosis. So I think it's overexertion. I think it's because of too much strain and because you have increased your exercise level too quickly. Okay, so you give the diagnosis and then you check. You pause and check. Is that all right? It means, do you agree with this? And once you get the agreement, then you go to the next one, and you say, okay, usually the reasons are not serious. It's just overexertion, too much strain on the muscles and bones. You don't have any numbness, which is a good sign. And we get worried if there is any numbness or any, if the pain goes down your legs or if it causes any problem with the power. And then, right, so the management options is basically the evidence shows we need to reduce the exercise level and increase it more slowly or more gradually. And this can be done with the help of a physiotherapist. Is that all right? Okay. And then after he says, all right, or maybe he says, no, I don't have time. And then you say, well, I'm afraid there's no other option. It's basically either this or you're going to get worse and you will be missing your competition. Um, or it actually affects your performance. Overexerting yourself gives you the reverse effect. Basically, you started to harm your body, and you will lose your fitness. Okay, you will have injuries. So basically, yeah, and the same way you can, if the patient doesn't engage, then you say, look, you have come to me with a problem. Okay, the ethical approach. You've come to me with a problem. I'm here to give you the best advice and to make sure you're not at any harm or not to cause you any harm. You can make a decision. I respect that, but these are the facts. And so you're a grown-up person. You're a wise person. You can make a decision. You're competent. You can make a decision. It's up to you. But what I can say is that we know for fact, this is evidence, this is science, that if you continue like this, you will definitely miss your competition. Right? So then, uh, and in terms of injection, you say, well, it's temporary, it's probably causing more harm, so it's not a good idea. So that is something that you need to address. Okay. So basically, yeah, you said, as you said, not to cut him off. How can we do that with proactive signposting and chunking? Basically, proactively structuring your explanations. Okay, and say at first you say get your agreement on your diagnosis. Say, okay, I think it is overexertion. What do you think? What's your opinion? I say, well, yeah, now that you're saying, I agree. Okay, right. So the reason is increasing the intensity too fast. Okay, right? Okay, so that's the reason or the cause. Now, what can we do about that? Or maybe the patient asks you, you say, "Oh, is that okay? Is that all right with you?" The patient says, "Well, okay, so what can I do now?" And I say, "Well, these are the options. Could I have an injection?" Well, not, in fact, injections are not likely to help. That's something you said more possible, or did you say, or less possible, something like that? Well, we usually use the word likely, okay? Um, uh, in Farsi, we use the same translation for possible and likely, but actually they're different. Possible means,
Oh, you're right.
yeah, possible means it is يعني محتمل. Okay. It
Yes.
means so you cannot say in this sense, you cannot say it's more possible or likely or unlikely. So get used to using this likely or unlikely. That is a better word here. Okay. So basically, when we are explaining, we don't do it. We don't make it personal. We're not saying you need to do this. Okay. We just say the objective language. You remember it in writing, factual objective language, descriptive. We say this is what science says. Okay. So we have evidence. We know for fact. Okay. Or our references or anything you like. But you don't say, I am saying this to you. No, there is evidence. And the evidence shows that overexertion causes pain. Okay. Uh, any problem?